Welcome to Unbiased Science, where we bring scientific method to the madness. I am your host, Dr. Sarah Scheinman. My co-host, Dr. Jess Steyer, is actually currently giving a guest lecture at Brown University, so we're very proud of her, but that's why I am flying solo today. But I am very, very excited to be joined today by Dr. Roberto Caricchio to discuss a topic that's very, very exciting and interesting to me in particular, which is lupus. So I'm going to read a little bit of a bio here, and then we are going to dive into our conversation. I've got lots and lots of questions. So Dr. Roberto Caricchio is the chair and chief of the Division of Rheumatology at UMass Chan Medical School and the vice chair of the Lupus Clinical Investigators Network Clinical Research Program, overseen by Lupus Therapeutics. He earned his MD and rheumatology training at the Catholic University of the Sacred Heart in Rome, with postdoctoral fellowships at the University of North Carolina at Chapel Hill and the University of Pennsylvania, as well as additional internal medicine and rheumatology training at Temple University, all while leading an NIH-funded lupus laboratory. He previously directed the Temple Lupus Program and founded the UMass Lupus Center. His work has defined mechanisms linking cell death, hormones, the microbiome, and infections to lupus pathogenesis and organ damage. He has published in leading journals including Immunity, Nature, and JAMA, and continues to lead translational lupus research and specialized clinical programs at UMass Chan. Roberto, welcome to the show.
Thank you. Glad to be here. And thank you for the kind introduction.
Oh, absolutely. I mean, honestly, there is no one better, I think, to be here talking to us about lupus than you, sir. So thanks for joining us.
Thank you.
I just as like a personal note, so when I think of lupus, I sort of grew up watching this medical show called House MD. And it's a medical show about a diagnostician. I think he's like an infectious disease specialist, and him and his team start out every time they have a case, they do this differential diagnosis, and they have this whiteboard where they write down all the possibilities. And every single differential diagnosis has lupus included, and so that but it's never actually lupus, and it's kind of a running joke for the show that it's not lupus, it's never lupus. So that's kind of what I know about lupus. But why don't we kind of start off by kind of defining for our audience, like what exactly is lupus?
Yes. So contrary to House, the show that you mentioned, in my case, actually, very often it is lupus, because we do get patients referred to us because our colleagues suspect that the diagnosis is actually lupus. So, but there is a good thing about that show, and that is that I believe very strongly that it did raise the awareness of lupus, nevertheless, among the population. So now many more people actually are aware of lupus, and that definitely helps the community, the lupus community especially, and perhaps even shorten the time that it takes to actually finally diagnose lupus. Now, what it is exactly? Now, exactly maybe is a strong word for lupus. When I teach the medical students about lupus, what I show them is the list of potential manifestations by which lupus can manifest itself. And that is basically everything that you can think of in internal medicine. So every organ could potentially be involved, and any clinical manifestation could be there. So that's why House pick up that disease, because it is very complex to diagnose. Having said that, what it is the quintessential systemic autoimmune disease. What does that mean? It means that the same immune system that helps us defending ourselves from infections, any infection, bacterial, viral, fungal infection, and actually even against cancer, mistakenly thinks that actually our own body is one of those entities, and it attacks them.
Hmm.
And because it's a systemic, it can attack any organ.
Right.
Now, having said that, most of the time, lupus patients will manifest with certain specific type of organ involvement, such as skin.
Hmm.
Skin rashes are very common in lupus, and are worsened by sun exposure.
Hmm.
The joints in the vast majority of cases are involved as well. Lupus patients typically have joint pain and joint inflammation. One more organ that is unfortunately very often involved is the kidney. And so inflammation of the kidney is actually a major problem in lupus, or at least for those 30% of lupus patients who have that particular manifestation. But the list goes on and on and on. Very often, patients with lupus have anemia,
Hmm.
so low levels of red blood cells. They have other low levels of type of blood cells in the blood, such as the platelets, which are important to help us stop the bleeding when we have a cut, for example, a skin cut, and so
Yeah.
on.
So what I'm hearing is that there are what's difficult about lupus is that it involves so many different organ systems. Like you mentioned, it's systemic. So I imagine that patients experiencing these symptoms might face some challenges and some maybe diagnostic delays when it comes to clinicians picking up on this particular condition as the cause of the symptoms. Is that true?
It is true. It is better
Hmm.
though, compared to a decade ago. Definitely, for a lupus patient, might have taken up to 2 years, 3 years actually, to get
Wow.
diagnosed. Um, right now, I mean, now that the awareness is actually stronger and higher, then it takes less. Having said that, some lupus patients, I would say actually a good fraction of percentage of lupus patients do not manifest very obviously, meaning that they might have one or two manifestations that do not make the whole lupus or do not allow a full diagnosis. So that definitely delays in the eyes of the
Sure.
non-expert. So there is also that component. We do have criteria. The latest iteration is from 2019, which they do a pretty good job in classifying lupus patients. Although they are not used in clinical practice, they are primarily used in
Hmm.
research for clinical trials enrollment or for mechanistic studies. But not every lupus patient fits those criteria up front. It might take
Right.
actually months or up to a few years to actually develop the full blown lupus, and that is actually a known phenomenon, scientifically speaking. Work from more than 20 years ago has very elegantly shown that lupus patients do not become lupus
Hmm.
patients at once,
Right.
but actually is a multi-step event where the autoantibodies, the signs in the blood of lupus, comes first. And then over the years, more and more manifestations, more and more and more, until the full-blown lupus actually can be diagnosed. So also that is one of the reasons for why there is, in a way, delay in diagnosis. And I wish we had a marker that we can screen all the population and determine who actually is going to develop lupus. Because in that case, we could actually even stop from lupus to develop, or perhaps delay the worst
Hmm.
manifestations.
So there are different stages of the disease, then, is what I'm hearing. And
There are different steps to eventually develop the
okay,
disease.
got it.
But within the disease, once developed, there are phases in which lupus patients have a low level of disease or perhaps a complete remission, which
Hmm.
is not common, to really flares that unfortunately require hospitalization.
Got it. Got it. Wow. So, are there different types of lupus, or is there just kind of this one kind of umbrella term?
No, good question. Good question. I guess you're used to this. There are different types of lupus. the lupus that I have spoken so far about is what is defined as systemic
Right.
lupus erythematosus. Now, there are different types. There is one in particular, which is relatively common, and that is discoid lupus erythematosus. And what it is characterized by is really only skin manifestations. This type of lupus, for short DLE, does not involve major organs outside of the skin. Then there are other types which are also involving just the skin, and in that case, they're called cutaneous lupus or subacute cutaneous lupus. Also, in that case, only the skin is involved. And in a very small percentage of cases, in those two types of skin lupus, then the patient can evolve into a systemic lupus. But it's a very small percentage, 5% or less.
Okay.
So having said that, there are actually more rarer types of lupus due to a single gene mutation, and there are several of those. But those are very rare and constitute maybe 1 in 5,000 or more lupus patients.
Okay.
And they're called monogenic lupus.
Sure. Okay, so I'm glad you mentioned genes because that's another thing that I wanted to ask about. Is lupus a genetic disease, would you say?
Yes, also very important question. And then yes and no are
Right.
good answer.
Yes and no. Always the case.
Yes. So the example that I always make to let people understand the relevance of genetics is the example of identical twins. So you would imagine that in identical twins, both contract the same disease. And when it comes to lupus, what is called the concordance is 30% or so. What does that mean? It means that out of 10 identical twin pairs, only in three cases, both twins will develop lupus.
Oh.
The other 7 will not.
Wow.
Only one of them. So what does that mean? It means that the genetic component is very strong, though, very strong. 3 in 10 is still very strong. But it also means that it's not everything.
Right. Less than half.
Yes, but it's still a lot, though. It's still a significant component. It's just that it's not everything.
Sure.
So there are other components, possibly environmental factors, which we are still looking into. We do struggle yet scientifically to determine which one are they, but definitely that 30% indicates a very strong component, genetic component. And in fact, we do know that what are called single nucleotide polymorphisms. So certain genetic abnormalities that might occur in more than 1% of the population, specifically lupus, are more common in lupus than in the general population. But there isn't a single specific gene that we can say, oh, okay, this gene is responsible for lupus, outside of what I mentioned as monogenic. Right. But those are very, 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 very rare. The vast majority of lupus patients, they have what is called a genetic predisposition to develop lupus. But it's not an inherited disease.
Right.
It takes more, such as those environmental factors that we don't know, that there are a number of laboratories around the world try to identify those.
Yeah. So maybe we could talk a little bit about that. I mean, because I know you mentioned that it's a developing body of research, right? In terms of like those environmental factors with those, like, you know, the 70% that is not that genetic, you know, that doesn't have that component. So what would you say, you know, are some of those factors? Like you mentioned a few, but what are some environmental risk factors, I guess?
Yeah, no, well, sure. So that environment, by the way, I don't want to, I'd like to define the environment.
Yes,
as
please
well.
do that.
So
that's
environment
important.
is not, yes, so it's not just the external world
right.
of ourselves, where we live or what we eat. It's also the hormonal
yes.
environment. So estrogen and androgens. So the hormones that define
Okay.
our sexes. For example, lupus. If you take 10 patients with lupus, the chances are that 9 are going to be women and 1 a man.
Really?
So yes, so
So it's overwhelmingly seen in female populations.
overwhelmingly seen in females, in women,
Wow.
and yes, and one of the factors, environmental factors that we think are
Mm-hmm.
very important are the hormones, because it's an obvious difference, right?
Right.
Having said that, can we change that hormonal environment and make lupus better? Well, so far we were able to do that only in mice,
Mm-hmm.
mouse models, not in humans. We have bits and pieces of information about what a female hormonal environment can do. For example, can better activate B cells. B cells are the cells that produce antibodies, and in particular,
Mm-hmm.
in autoimmunity, auto antibodies, those
Right.
molecules that attack our own organs. So there is that, but an effective treatment based on the hormonal environment has yet to be developed. One other environmental factor that we think it's a trigger, at least it does increase the severity of the disease, is sun exposure.
Right. This is something I've heard.
So
Yes.
patients with Yes, so patients with lupus are many patients with lupus are characterized by very harsh and exuberant reaction to
Mhm.
sun exposure. And in fact, we recommend every lupus patient to, especially those who have a cutaneous manifestation, skin involvement, to really wear a nice hat, and but also to wear sunscreens multiple times during the day, because they tend to fade away with our sweating,
Right.
perspiration, because of the risk of inducing flares.
Okay.
Flares not just on the skin as rashes, but also systemically.
Okay.
So that's another environmental factor. A third one that is also well established, at least from a research point of view. We still cannot really intervene as on the factor, is certain types of viral infections. One in particular is the EBV infection, Epstein-Barr virus infection, which it seems to increase the chances for lupus to develop.
Oh, wow. Okay.
Having said that, more than 90% of the world population is infected, so it's not an uncommon infection, but it happens to be really detrimental in lupus.
Hmm. So it sounds so there are lots of different factors at play here. And I'm glad that you defined environment for us, because oftentimes when we hear environment, we think like, oh, just, the climate or what we're exposed to when we go outside. And I'm glad you kind of expounded upon that. It's really not that simple. So
No, it's not. It's not. Another one that I would actually mention, because I think is important,
please.
is the microbiome.
Oh,
Um,
yes.
so
Hot
which is
topic.
also an environment. It's another environmental factor.
Sure.
We have this agreement, so to speak, with the microbiome,
Hmm.
symbiosis. So an agreement between the two of us to survive, meaning that we do need the microbiome, and the microbiome needs us in our gastrointestinal system. But it appears that in lupus it is different, and
Hmm.
it is more pro-inflammatory.
Okay.
It's still at the beginning as types of investigation, because there is a lot to know in general about still to know about the microbiome and to discover.
Sure.
But I think it's quite established that the microbiome in lupus, it is has a features of pro-inflammatory and more able to induce an immune response, which makes sense.
Yeah,
Makes sense
absolutely.
because lupus is a constant immune response against the person, the individual, herself or himself.
So switching gears a little bit, I'd like to talk a little bit about diagnostics when it comes to, so you've got someone comes into the clinic, like in the example of House MD, someone comes in, they're presenting with all of these symptoms, and a lot of them are involving different organ systems. How do you go about establishing that lupus is the diagnosis for a patient coming in?
Yes. Well, it's simple when the patient has classic manifestations,
Right.
but the classic manifestations are less than 10%. So
Oh, wow.
combined, so
Okay.
it's not well. Yes, yes. So there is a term that in medicine is a fundamental approach to diagnosis, and that is the differential diagnosis. So when a patient comes and has a few manifestations, then the physician should think of few possibilities, and from there test the patient with blood work and physical exam and
Mm-hmm.
perhaps imaging studies, and then come down to one or two, and then eventually make the diagnosis. And that's lupus is not an exception. That's what it is. As I mentioned, generally speaking, a patient with lupus will have some form of joint involvement. So in our case, very typical, a differential is between rheumatoid arthritis, which
Mm-hmm.
is much more common than lupus, and lupus. And what really distinguishes lupus from many other autoimmune diseases or rheumatic diseases is really the systemic aspect.
Right.
So it might be a joint involvement, but very likely there is going to be some other organ involvement,
Mm-hmm.
and and a number of abnormality in the bloodstream. As I mentioned, people with lupus might have decreased red blood cells, decreased white blood cells, and platelets, which are very important components of the blood that help
Absolutely.
in many ways. And so by targeting the physical exam, uh, uh, getting a good history of the patient. If you let patients talk enough, they will tell you what's wrong with them.
Right.
And then yes, yes, and then blood work, very very targeted blood work, which we start with what is called auto antibodies testing. Lupus has the broadest types of autoantibodies to be tested, and some are very specific for lupus. So if the patient is is positive for those specific tests, which usually are called, and I'm sorry for the jargon, but anti-SM or anti-double-stranded DNA,
Mm-hmm.
the likelihood of having something like lupus is very high, along with clinical manifestations and history of the patient.
Sure.
So that's how we go by. It takes some time before one develops the skills to
Right.
distinguish between lupus and other diseases, but that's how we go by.
Sure.
Although, admittedly, it's much more complex than what I explained right
It
now.
always is. It always
Yes, that's
is.
much more complex. I just make it simple, though.
Mm-hmm. So, Roberto, what about treatments? Are there any promising treatments that are on the horizon for someone that has lupus?
Promising treatment is an understatement.
Right.
Yes, it's a vast understatement, because what has happened and what's happening in lupus is truly unprecedented. So for 50 years, we didn't have any really FDA approved intervention in lupus. And when I mention FDA approved, that has really an important meaning. That is, it means that whatever was thought to be effective in lupus underwent a rigorous investigation, such as multiple phases of a clinical trial, until really proven that it made a difference
Mm-hmm.
in making people with lupus better. So that's what FDA approved means,
Sure.
and it also means that it takes years to get an FDA approved medication, because it's a very rigorous mechanism to show efficacy. And so we had nothing for 50 years. What was approved on those 50 years actually was really grandfathered into FDA, because they were used before even the FDA was actually created. Until one medication showed finally that it had an effect in lupus. That was 20 years ago or
Hmm.
so, belimumab, a little bit less. Fast forward only a decade from that approval, then there was really an explosion of interest in lupus because it was a pathway to understand lupus along with the understanding of the pathogenesis of lupus.
Right.
And now we have three more approved interventions, possibly
Wow.
two more this year. But even more than that, cell therapy, cellular therapy, which was borrowed by our colleagues in Germany from the hematology oncology world
Yep.
and tested in lupus, has demonstrated a concept that we didn't really have before. And that is that we can induce with a single treatment at such a reset of the immune system, and in this particular case for lupus patients, a reset of the autoimmune system, that what comes back is no longer autoimmune. Meaning, what comes back there is no lupus to be found. And therefore, there is no lupus to be found in the patient, both from blood work to manifestations.
Wow.
And it's also durable. The first
Hmm.
patient was treated in 2021.
Oh, wow. So this is very recent.
Yes, they're still out treatment. No lupus flares, no lupus at all. They're actually off treatment since then.
Wow.
Our first patient was almost 3 years ago now, in 2023. We were the first in New England, and she's still fine. No lupus and no treatment. And because of that dramatic and unprecedented, really result, then now there are 30, 40 clinical trials on this type of modality. And at the same time, that was the original way of treating lupus patients with CAR T or cell therapy. But at the same time, so over the last 3 years, two more similar modalities have come to be actually tested also in lupus disease and the other connective tissue diseases that also don't have particular treatments. So, in other words, or in summary, there has been an explosion of possibilities to actually put lupus into remission in many patients.
I mean, it sounds like this is almost like would you say that this is a true cure?
So I'm a little bit hesitant to say a
Sure.
cure, and there
Absolutely.
is a
Yeah.
reason for that, and I can explain why. Um, so the immune reset, so this type of treatment really get rid of those autoimmune cells in the tissue where the disease is, in the kidney, in the lymph nodes, in the spleen, wherever the disease is. This treatment will kill the cells that are inducing the disease. And then those cells will be reproduced by the bone marrow. So they will reconstitute.
Right.
But when they come back, they are no longer autoimmune. They no longer induce the disease. Okay?
Hmm.
So it seems like a cure.
Right.
What I like to call it is a clinical cure. And the reason
Sure.
is because those cells that come back, even though they don't seem to be autoimmune, they still carry that genetic predisposition that I mentioned before. So,
Right.
yes, so we did get rid of the active part of the autoimmune cell, but we did not get rid of the genetic part. And so, only time will tell how long a single treatment will be able to last. Will it
Absolutely.
last a lifetime? Well, we are still waiting, and we will wait for a
It's
very
very
long time.
new. So,
No, or we don't know. We don't know. Or will it last a few years? Either way, it is a success because
hmm.
we are giving patients the ability to feel disease-free and drug-free for quite some time. And we can repeat the treatment because there are different modalities now that we can actually redo the same treatment and possibly give the patient a very long, very, very long remission period of time. So, but to call it a cure, I would,
It's a strong word.
yes, but I would add this though. It did give us a pathway to a cure.
Okay.
It is giving us a pathway and the means to think about how to cure this disease. That I think I can say.
All right, fantastic. I love it. I mean, we always like to end our episodes with, a little bit of hope. And sounds like this is very promising, but I wanted to ask you, is there anything else that's kind of giving you hope right now for people with lupus? It sounds like there's just so much that's happening now that even, a decade ago wasn't available.
Yes. So before I tell you what gives me hope, I do want to say though that this is not. I mean, the treatments that I mentioned that reset the immune system gives patients a very long time of remission, drug free. Uh, um, they're very complicated. They're very complex
Right.
treatments, and in collaboration with my co-chair Sarah Sheik and other members of the LUSIN that you mentioned before, the Lupus Clinical Investigator Network, we published a pathway for investigators around the country and around the world to actually set up those treatments
Wow.
with their hematology colleagues.
Hmm.
Because what we need is more and more patients to be treated with this modality so that
Right.
one, more patients can enjoy it and take advantage of that, and two, demonstrate that this is a true a pathway to a cure and a clinical cure. So, I would like to make sure that people know about this. So that there are ways to get help to initiate those treatments, those clinical trials, because right now there are only few specialized centers, including ours, but few specialized centers that they can offer this modality, and that publication can help actually guide the process, which is a complex process.
Right.
And that was sponsored by the Lupus Research Alliance, which is doing a spectacular job to help patients with lupus and help also fund the research that has led to approval of those medications, but also to those interventions that are very complex. So kudos to that as well. Now, what gives me hope? Well, I think I did mention already a little bit what gives me hope. Uh, um, so, if you there is a website run by our government, which is called clinicaltrials.gov. Anyone can go; it's public, and can search for any clinical trial or the vast majority of clinical trials ongoing in the United States, but also in the rest of the world. And there are around 150 undergoing in the world in lupus and lupus nephritis. So that is specifically lupus nephritis, actually. So many more in
Right.
general lupus. So this is an explosion of possibilities of really taking care of every single lupus patient, irrespective of the type of manifestation they have. So that is never that has been unprecedented. No time before there has been such a possibility to really make this disease just as if we were uh, um, a little bit of hypertension that needs a pill to be treated, and you forget
Right.
about it. You do your exercise, you mind your diet, and you'll have a very long and healthy life. We are very close to that because of the explosion of understanding of lupus pathogenesis and the explosion of technology that can help mitigate this autoimmune system. So there is more than hope. It's almost a certainty. 20 years ago, I had a different conversations with lupus patients. The conversations that I
Right.
have today is just, I have so many options. We have all these options. Let's start trying one and see which one best suits you. So that's a completely world. And 10 years from now, I hope I can tell a patient, here is the treatment that we're treating today. Here is the treatment 10 years from now. I can tell you that if we go through this, you'll have perhaps a decade of no lupus inside. And then maybe in a decade, we'll repeat the treatment if something comes back. So that is a hope today but it might become a reality a decade from now.
Amazing. We've come such a long way since the days of House MD, haven't we?
Yes.
This is giving me hope too.
By the very long way, yes.
Dr. Roberto Caricchio, thank you so much for joining us. I learned a ton from you today, and we're going to link some of the places we can find your research and your work in our show notes. And just thank you for joining us.
Thank you. Please link our lupus program.
Absolutely. For sure. There are lots of incredible sources that and our listeners can go and check out all of the wonderful work that you guys are doing. So thank you again.
Thank you for doing this as well.
Oh, it's our pleasure. We love it. And I would just like to thank all of our listeners. Thank you so much for tuning in this week. We hope you learned a thing or two. Please join us next week on your trusted source for no nonsense, just science.